Hey y'all, welcome back to the channel. If you are new, I invite you to subscribe. It really does mean the world as I am trying to break that 200 sub threshold, so please and thank you. If you're a returning visitor to the channel, I am eternally grateful for you choosing to come back. But if you are new, I will preface this as I do most of my videos with letting you know there are three main pillars to my channel. Number one being Disney content, of which there's a little bit of a drought right now, but hopefully for my birthday in July, I will be going home and be able to inundate you guys with all of the vlogs you never asked for. The second pillar of my channel is film, TV, literature reviews, most of which are done with my partner in crime, Chad, our Chad and Mel movie hours. I invite you to check those out. And the third pillar of my channel is women's issues. The majority of what I talk about is my involvement with a nonprofit called #HappyPeriod, which provides menstrual hygiene products to the homeless and underserved menstruators in any given community. For me, it's the Bay Area chapter. And of course, my third pillar goes well beyond the scope of just #HappyPeriod. I have an entire playlist, a series on the politics of periods, and I'll link that in the iCards. I really invite you to check that out because that's some of the most important content to me, and it's some of the most important content in terms of disseminating information that I think is important. And beyond that, I've shared a lot of my own personal experiences, you know, anything, sorry, sirens, pause. I've shared a lot of my own personal experiences, anything from my involvement with #HappyPeriod, to my thoughts on things going on in the media around women's issues, political issues surrounding women, sexual harassment, you get it, all the way up to sharing my personal abortion story. So if you are not interested in today's video, which is going to be in the Politics of Periods series, but it is going to be very much a conversation about abortion in the wake of the COVID-19 pandemic. So if this is not for you, I'm giving you a fair warning, but I invite you to maybe take a chance and dig into some of what we're going to discuss, because I think it is enlightening to say the least and really puts into context how much healthcare workers who work with female reproductive rights, just how invaluable they are, how underappreciated, and how they are coping with an already difficult situation in terms of providing these services to women. And, you know, now that is coupled with COVID-19. So that's what we're going to talk about today. So without further ado, it's going to be a long one. Cheers. This is going to, and I'll link everything in the description box, but this is predicated off of an article that I read in April, which it came out on April 28th, and I'm going to be referring to my notes over here, so I apologize. And the article was published on fastcompany.com, and it was titled, "For Many Women, Abortion Access Was Already Limited, Then COVID-19 Hit." So this article is going to, and this discussion is going to kind of give some context for what it was like for somebody to try and get an abortion in Trump's America prior to COVID, and how much more difficult it has become since coronavirus, and how COVID-19 legislation is being used to slip in anti-abortion policy into things like the CARES Act, et cetera, and so forth, and how it's undermining the ability for women to get access to reproductive care in general, not just abortions. And then I'm going to reference a Vice article that actually came out today, May 30th, that is going to give a little bit more of an updated moment on what's going on specifically in the state of Missouri, which is down to one abortion clinic. So suffice it to say, I am pro-choice, if you didn't already get that. I have had an abortion. I am for Planned Parenthood. I am for a woman's right to choose, for a woman's ability to have and execute full agency over her body. And yeah, so I'm obviously left of center, if you didn't already get that from my channel. But without further ado, let's talk about the article. So the article actually opens with an anecdote from a doctor named Shanthi Ramesh, who works for Planned Parenthood, and she had recalled how she saw 3 patients in the same day, all of whom were frontline healthcare workers. 2 worked in the emergency room, and 1 was actually volunteering. And this is happening in the midst of COVID-19. All 3 women were there to have an abortion. And the article goes on to discuss that this particular doctor at Planned Parenthood being, just struck by the fact that these women are on the front lines in the emergency rooms dealing with people that are testing positive for coronavirus. They're the people that are helping to save lives, and they are in need of what I consider to be a necessary procedure, and they're struggling to get access to said procedure. And what does that mean when the people that are trying to take care of us can't get the care that they need, which would ultimately enable them to potentially save lives? One of them was a single mother. She was obviously working full-time in an emergency room. She needed to have an abortion. One of the other women, I believe she was the volunteer woman, had kind of spoken about how prior to coronavirus, this was already a difficult thing to deal with and get access to. And Corona just, exacerbated this. And this is in the state of Virginia. And this particular Dr. Ramesh said, quote, "I was so struck by the juxtaposition of this conversation that we're having on this high level around abortion as essential health care, and how essential health care was for these women." This Dr. Ramesh is the medical director at the Virginia League of Planned Parenthood, and she goes on to say there actually are healthcare workers who need to access this service in order to continue to care for our community. We have to remember that these women who are having abortions and procedures that you may not agree with may be the very same people that save your life. And what does that mean when we don't grant them the same respect to take control over their own medical situation? And if they can't get access to an abortion, or they have an unsafe abortion and they get sick and they potentially die, those are resources. Those are healthcare resources that are no longer on the playing field. And it's just it's disgusting. It's just a vicious cycle, and it's one that people don't like to see the thought process or the argument or the rationality all the way through. They get hung up on their faith, their beliefs, their fundamentalism, what they've always believed, and are just not able to think beyond the scope of that. And that is crippling the country pre-corona, and it's crippling the ability for it's crippling to the morale of the women that are already giving their all as frontline healthcare workers. It's just, I can't. They want to know why I drink. This is why. Sindel's making a cameo. She's very upset as well. But yeah, she was reminiscing on how these women are mothers. They're trying to take care of the children they already have whilst being frontline healthcare workers, and they're just struggling to gain access to something that should be fundamentally across the board legal, number one, and number two, should be easy to access. Women should not be having to drive cross their states, let alone crossing state lines, just to find an abortion clinic. This stuff was already going on before Corona. I'll be a broken record about that. Legislation under the Trump administration has been, since day one, undermining women's access to Planned Parenthood even. And most of these women that are going to Planned Parenthood are not going in to get an abortion. Most women are going in to get their birth control, to get their women's exam. This undermining has been going on for the past 2 years, and these anti-abortion policies have been slowly, but snowballing to a point where Roe v. Wade is on thin ice, and it's terrifying. It's terrifying how close we are in 2020 to Roe v. Wade being overturned. Anyways, the article goes on to say, that these women, if they could get access to these abortions, have the safe procedure, they could continue acting as essential workers because they had access to the care they needed, even amid stay-at-home orders. So this is where we're going to kind of segue into what this feels and looks like for women trying to access it in the midst of COVID. When coronavirus took hold, states with restrictive abortion laws, and I'm going to link a couple of articles and some links to some diagrams that will show maps with which states have which policies, etc., and so forth. But states that already had restrictive abortion laws seized coronavirus and COVID-19 policy as a means to roll back access to abortions and implement more anti-abortion policy. Leading up to coronavirus, 8 states, Arkansas, Alabama, Iowa, Louisiana, Ohio, Oklahoma, Tennessee, and Texas, don't even get me started on Texas, were actively seeking to ban abortion by classifying it as an elective procedure and citing, this is the sickening part, not only were they trying to classify it as an elective procedure, but they were trying to cite the need to conserve personal protective medical equipment for healthcare workers treating COVID-19 patients. Walk that lack of rationality all the way back to the beginning and tell me how that makes any kind of fucking sense, because it don't. Anyways, so a lot of abortion advocates, which I don't like that language per se. I use that language. I'm an abortion advocate, but I think, no, fuck it. I like that language. I'm an abortion advocate. I retract my earlier statement. But abortion advocates, rather, are aware that politicians are using this as a means to slip in legislation to continue to roll back access to abortion. Let's see. They're singling out abortion providers as unable to make similar determinations and consultations with their patients. So one of these, Molly Duane, who's a staff attorney at the Center for Reproductive Rights, was articulating that when you go to see your general practitioner or your regular OBGYN, you and your doctor together are able to make determinations on whether or not a procedure should, be necessary or elective and when to do it. And she goes on to say that in the midst of this pandemic, the state's policies and the anti-abortion folks are basically taking that same right, that same doctor-patient privilege and relationship away from doctors that perform abortions. It's crazy. A lot of the states, a lot of those 8 states were able to get, at the state Supreme Court level, bans. They were able to file lawsuits, basically, that like Planned Parenthood filed one, the Center for Reproductive Rights filed one, that were essentially able to kind of block the furthering of shutting down of clinics and just overall hit pause on the anti-abortion situation. Texas has a population of roughly 29 million people, and every single week, basically for the last 90 days, they have sought to bring new rulings to the courts. The law in Texas keeps changing from one day to the other, from abortion is legal to abortion is not legal, to it's legal but only up until a certain point, or it's legal but you have to have an ultrasound, or it's just a fucking joke. It's a fucking waste of time, energy, resources, lives. Don't even get me started. So essentially, Texas caved to all of the protests and kind of rolled back their efforts to eliminate abortion in their state, but it's still touch and go. There's a woman, Camion Connor, who's the executive director of the Texas Equal Access Fund. Basically, they provide financial assistance to women that are trying to have an abortion procedure, travel expenses, because a lot of these women are having to travel across their states or even across state lines to be able to have said procedure. And having gone through this myself in Florida many years ago, the mandatory ultrasound that is required by many states it's borderline sociopathic. They require that you have a ultrasound, which gives you an opportunity to see, the sonogram and see the image of the fetus. And it's just completely unnecessary. It has been deemed unnecessary, medically speaking, and yet it's still policy in a lot of states. And not only do you have to go into the clinic for a consult, not only do you have to go in for the procedure, but you also have to go in for a consult, and those don't always happen on the same day. So, excuse me, if you're traveling from far and wide, that's another financial burden. That's another psychological and emotional burden that women have to bear, where they just want to get the procedure done and over with and move on with their lives. Let me say this once, twice, and forever. No woman enjoys having an abortion. It's not something that we do for fun. And the idea that people think that any woman that's had an abortion is doing it flippantly or making the decision lightly, closed minds can't get changed. I don't even have time. But the idea that you might have to endure that 24 hours between a consultation and the procedure, like the psychological warfare that is being aimed at these women, is just, it's disgusting. It's absolutely disgusting. She speaks to this. She says they have an appointment one day, then they don't have an appointment because the states keep going back and forth. People are losing their jobs, they're just to get time off to try and get this procedure. She talks about how literally she was in the middle of a procedure when the state, and this is in Texas, Dr. Bhavik Kumar, who was in the Gulf Coast Planned Parenthood chapter in Houston, was literally in the middle of a procedure when they overturned a block on the state's abortion ban. I mean, I cannot. Yeah, women are being told they have an appointment, they show up for the appointment, then the providers can't provide said procedure because the law changed that day, then it changes back the next day. I had a very, very positive experience when I had my procedure. It was quick, wasn't quick, but relatively speaking, it was quick. It was a one-day affair, and the worst thing I had to deal with was ignorant religious right protesters, shouting at me to and from the vehicle. I can't imagine, I cannot fathom what this would feel like. I just can't. I cannot. Yeah, and the providers are talking about in this article, how difficult it is for them because they don't know what's going on from one day to the other, if they'll have a job from one day to the other, but more than that, that it's absolutely heartbreaking for them as providers, as medical practitioners, to not be able to look people in the eye and say to them, I have all of the tools, I have all of the resources, I can treat you, but I can't. And how heart-wrenching it is for them to have to say that to the people that they want to caretake. Anyways, she literally says, the same doctor, quote, we technically are able to do this. We have the means. We have the training. We have the skills. We have everything here, but we're not allowed to do it. And to hear people's frustration, to have them beg you for help, it doesn't feel good. It feels inhumane to treat people this way, and it leaves us speechless. So, what are you going to do? So, the article goes on to talk about the risks of getting an abortion during lockdown. So it's already a complicated process, we know this. In Texas, under state law, all providers must abide by a 24-hour mandatory waiting period within 100 miles of a clinic, which means women are typically required to show up in person for both, as we talked about, a consult and then the actual procedure. And then, of course, on top of that, being forced to have an ultrasound performed on them, which many advocates and health professionals have deemed medically unnecessary, which I mentioned earlier. Even a medication abortion, which is where you take the 2 pills, what is it, mifepristone and misoprostol, they can no longer just dole out those pills and you can go home and have your abortion in the privacy of your own home. They now have to be done in person, and only up to 10 weeks. I mean, and now they're having, in the midst of COVID, they're having to do these consultations through, what are the, tele appointments? What did they call them? Telemedicine. So you basically have to Skype your doctor, have the consultation. I can't even wrap my head around what the F is going on. Last year, a number of states also tried to introduce laws that would ban abortions later than 6 to 8 weeks into pregnancy. I had my abortion at 6 weeks. 6 to 8 weeks ain't shit. Like, I was in the room with the woman I was paired up with in the waiting room prior to going into our procedures, who was far along in her second trimester. The idea that they're capping it at 6 to 8 weeks, I'm getting aggravated. I'm getting so aggravated doing this video right now. Like, I cannot. But again, coronavirus. They're trying to limit the exposure to the virus, which provides another hurdle in getting these women access to the procedures in a safe way. So again, they're doing like telemedicine for screenings and counseling where possible. They said that many patients were requested to stay in their cars up until the procedure to limit foot traffic in the waiting rooms. I can't imagine that. I cannot imagine having to sit in my fucking car for hours waiting to be called in. That is psychological warfare. Many of these clinics have chosen to expand their hours just so that they can accommodate the women whilst social distancing. Yeah. All right, I just read that. So in addition to the patients being vulnerable to exposure to the virus, the staff is as well. The medical staff is as well. And what's happening that's exacerbating an already nightmarish situation is that the anti-abortion protesters, excuse me, who are always outside of the clinics, usually are just there with signs and are screaming at you while you go from your car to the clinic and back again. These morons, these absolute fucking morons, are gathering with strangers outside of an abortion clinic with no regard to social distancing, with no regard to what is going on around them, with no regard to science, rationality, facts, empathy, and are essentially creating an environment where they can spread the virus whilst spreading hate. It's like, just when you think these idiots can't get more evil and more ignorant, why am I surprised? Dr. Ragsdale at one of the clinics in Texas said they would literally surround the car and scream at the patient, which has always been the tactic. But now, in addition to screaming at them while they're sitting in their cars, they don't give them room to get out of their car and into the clinic without being touched or coughed on. Deep breaths, Melissa. The National Abortion Federation, which is an abortion advocacy group, has their own clinics nationally, and they are talking about one of their clinics in North Carolina, and the clinic had been thronged with 150 protesters after the state barred gatherings of more than 100 people in any one location. In Michigan, the state has exempted religious services from its ban on gatherings, so anti-abortion groups are evoking religion to defend their protests. Moving on. Dr. Ramesh adds that the usual group of protesters has continued frequenting multiple Planned Parenthood affiliates in the state of Virginia as well. She goes on to say it's just completely disrespectful in this moment of public health crisis to be blatantly ignoring rules around social distancing. They have their own agendas and clearly don't care what's actually happening in our health centers and the people we're taking care of, one of whom may be an ER nurse who saves their life when they get coronavirus. C-formation. Take me to church. Take me to church, Dr. Ramesh. So there's a lot of states, those 8 I listed at the beginning are some of them who already have very few clinics in their state, with very stringent rules and access, the whole thing. Women are already jumping through hoops, and then the Guttmacher Institute, which is a research think tank, a research group that does support abortion rights, so of course they're going to be biased, but they did provide statistics that about 89% of counties across this nation as of 2017 did not have an abortion clinic. Let's read that again. Let's just round up because it's fun. 90% of counties across this country as of 2017 did not have a clinic in said county, which means women are having to drive, leave their jobs, leave their children, leave their lives, everything on hold, just to drive God only knows how far to a clinic, just to have you see what's happening here? It's almost wine o'clock. Okay. In rural parts of Texas, patients were traveling on average more than 300 miles just to get to their closest clinic. This is also happening in other states as well, including Missouri, which we will circle back to. There are reports coming out that, and this is substantiated in the New York Times and the Washington Post, Huffington Post, CNN. It's a fact, and it's not just coronavirus, but it is a fact that minorities, and in this case, women of color specifically, are people of color specifically are more susceptible to getting sick and are more susceptible to dying from things that otherwise wouldn't cause said death in, say, white people. This is an economic issue. This is a whole other can of worms. But women of color are even further down that totem pole in terms of risk to their health. And so there have been several reports coming out about that in relation to COVID-19. Black people are dying at a exponentially larger rate than are white people. The TEA fund, which is the fund I mentioned earlier that helps finance women's ability to get abortions, said that the majority of people we support are black women who are already mothers. 70% of our clients are people of color or already parenting. At a time like this, it's painful to use pandemic to restrict access. Before the abortion ban in Texas lifted, there was a woman in Houston who reached out to the Lilith Fund, which is another abortion advocacy group that serves centers across Texas. This woman had to travel 1,500 miles to get an abortion in Atlanta, despite living 3 miles from her clinic. This pandemic is hitting at the heart of our work and makes it more needed than ever, but also certainly more complex, says Odile Schlate, who is the executive director of the Bridget Alliance, which provides travel assistance to those seeking later term abortions. Quote, so systems that we used to be able to rely upon, like airlines, are now both a combination of less safe and less reliable, end quote, obviously referring to the travel bans under the pandemic. They've done things like help patients rent cars, get whatever resources and travel accommodations are necessary to get them to a clinic. She references one trip that was nearly 18 hours and took a patient from Alabama to New Mexico. And these are the women that are lucky enough to have access to a nonprofit like this. Think about the women that can't. Think about what they're thinking, what they are feeling, what they are coping with. Think about it. Just think about it. Think about it. Let your heart think about it. I cannot. I'm losing my mind here. And another thing that these organizations do is they find accommodations for these women whilst traveling to said clinics, and oftentimes because of budget, rather than paying for a hotel room, they will find a host family or a host home. That can't happen anymore with quarantine, so that is one other layer of icing on the shit cake. This one woman who remained anonymous that was trying to get an abortion. I don't even know where to begin. What's her name here? Bear with me, folks. Diana Parker, who is part of the Midwest Access Coalition, again, a nonprofit offering support and assistance to patients traveling to or from the Midwest for an abortion procedure, said, quote, this is the first thing we put on pause because we didn't want to put our host families in a position to have to say, no, I don't want, I want to take care of myself and my family. We didn't want to put them in the position to feel guilty. We also just didn't want to help spread the virus among our clients or our volunteer base. This is a no-win situation. This is a no-win situation. The majority of women that have abortions are already mothers. Please keep that in mind. Stay-at-home orders have made the clinicians and the medical professionals work harder. Abortion funds are accustomed to navigating a lot of hurdles, but their resources are more restricted now, and they're also needed now more than ever. So what do we do? What? You tell me, what's happening? The world is burning. Okay. Moving on. So a lot of advocacy groups and lawmakers that are obviously left of center on this issue are calling for the FDA to temporarily lift restrictions on medical abortion so women can access the drugs at the pharmacy or via mail. This is not anything we can rely on, but people are, of course, pushing for it. In response to the coronavirus, Planned Parenthood has rolled out a more robust telehealth service across each state, but that's not much use in states like Texas that make legal telemedicine abortions virtually impossible. It's legal still, but the hurdles, the nonsensical, fundamentalist, dogmatic, patriarchal hurdles are standing in the way of a right that we are legally I can't even think straight. Like, it's legal. We have a right to this, and we still can't get it. Like, we are centimeters away, millimeters away from all becoming handmaids. And if you think that that's me being over dramatic, you're wrong. In a handful of states, there's one viable option for women seeking in-home abortion care, and that is above board. And the teleabortion study, which is a research organization, which happened under a research organization called Gynuity. Interesting. That allows patients to consult with doctors from anywhere and receive abortion medication by mail. This launched in 2016. It has since partnered with 9 providers across 13 states, reaching about 750 patients a day. As the stay-at-home orders started rolling out, they saw a 30% increase in virtual visits for folks that can't leave their home. And teleabortion has been able to waive the ultrasound requirement, thank God, on a case-by-case basis. Quote, we're really trying to see how we can reach the remainder of the states that don't have a ban, just because the need is so great now. And yeah, it's unlikely the study will get greenlit to operate in states with really restrictive abortion bans. So the goal is to kind of expand into neighboring states and get access and get access as close in proximity physically to the women that need it. Erica Chong, who heads up the teleabortion situation, has generated a lot of interest from providers and clinicians. Unfortunately, because it's a research study, it's slow and cumbersome and expensive, but they are working to expand that program. One of their partners, CareFem, has 4 health centers in Chicago, Atlanta, Nashville, and DC. We've expanded the program now, and within the last 2 weeks, we moved it from being available only in Georgia to also being available in Illinois and Maryland. They've had private physicians reach out asking how they can assist. Thank God for these people. So strides are being made. People are fighting the good fight. It just boggles my mind, and at the same time doesn't surprise me at all that this is something that we have to fight so hard for. But the coronavirus has compounded the fuckery around getting an abortion. Women getting abortions are already more likely to be poor. In 2014, about 50% of women who had abortions were living in poverty, twice the share of low-income women who got abortions in '94. People are struggling to make ends meet, says Candace O'Brien, who works with the Yellowhammer Fund, which I am a huge fan of. I follow them on Instagram. I will link all of their resources in the description box. They are the most up-to-date with statistics, state by state, what's open, what's not, what the restrictions are. So I will make sure that you have all of that information. And what's great about the Yellowhammer Fund is they actually purchased a closed abortion clinic and reopened it. Hallelujah. I'll put a link to that article below as well. So you have the geographical barriers, you have the policy barriers, and then you have just the fact that most women who are having abortions are already mothers. They have to leave their children behind, which, to travel to get a procedure potentially, which means childcare is another factor, another hurdle. These women have to, if they don't have the support at home, find and pay for childcare so they can drive fucking 1,500 miles just to have a procedure that takes an hour. What do they want from women? Like, what, aside from enslaving us? Stay on point, Melissa. Some reports have already shown that the fallout from corona is disproportionately affecting women with financial issues, and particularly women of color, as we earlier mentioned. Women also, here's critical information, women also account for a larger share of the essential worker population. Nurses tend to be women. Women tend to need abortions. Are we connecting any dots? Oh, God help me. Yeah. So whether they are doing essential work or burdened with loss of income, many women who can't afford an unplanned pregnancy opt for an abortion. This is Dr. Ragsdale, who works with Yellowhammer Fund. We are rightly celebrating the nurses in the hospitals and the pizza delivery guys and the people in the grocery stores, all those people who are being celebrated as the heroes that they are. But nobody is celebrating our folks, who have been heroes every day for years and continue to be even in the midst of all of this. So that's the long and the short of the article. I think it's a fantastic article. It's the only one that I have found to date that really elucidates and articulates what the direct through line and connection is between essential frontline healthcare workers that are trying to save lives in the midst of pandemic and their inability to take care of themselves, i.e. get a non-elective but necessary procedure, in many cases, abortion, and how restricting access to that, take the politics away, take the religion out of it, take the fact that a woman needing an abortion can't get it or has to spread herself so thin to get it, that takes that person's resources as a medical professional away from the people that need it in the midst of corona, the people that need the testing, that need these nurses and doctors, and it boggles my mind that the dots aren't connecting and that people cannot see beyond their own. They can't see beyond their eyes. They can't. It's all laid out in black and white. Anyways, I just was very impressed by this article, and I think it's a very important article. Again, whichever side of the abortion issue you fall on, whether you are a person of faith, and this is absolutely in contrast to everything you believe. I do, as much as I've shat on you, I do respect your ability, I do respect your beliefs and your right to. I don't respect your beliefs. Let's take that one from the top. I don't respect the belief themselves, but I do respect your right to have said beliefs. The line is drawn when your beliefs begin to impose upon and impede another person's ability to take care of themselves physically, emotionally, mentally, and otherwise. So whichever side of the pro-life, pro-choice argument you fall on, just try and think all the way through the case that you want to make, you know. And this article does a really good job of bringing it full circle. You know, the women that are taking care of you and saving your family's lives from COVID-19 are themselves not being taken care of. And imagine if you are pro-life, you're in the emergency room, or one of your loved ones is in an emergency room, and the woman that saves your life just had an abortion. Does it matter? Are you grateful that she saved her life? Do you want to smite her? Just think about it. Think about it with your head. Think about it with your heart. Just think about it. The last thing I want to mention is the Vice article that came out yesterday, and I'll link it below. The last abortion clinic in Missouri, because Missouri, my God, they came from Missouri. They shut every clinic down. The last abortion clinic in Missouri just won its battle to stay open. It was a vindication for Planned Parenthood in St. Louis, who had been fighting to keep the clinic open. The Republican governor Mike Parson was wrong to deny Planned Parenthood a license to offer the procedure. They basically tried to shut down the clinic, saying that there were deficiencies in the clinic, like it wasn't up to code, bullshit like that, which just false. So anyways, if the state had successfully shut down Planned Parenthood's clinic in Missouri, it would have been the first state to go without an abortion clinic since the Supreme Court legalized it via Roe v. Wade in 1973. So this one clinic is the holdout. It's just insane to me. Planned Parenthood demonstrated that it provides safe and legal abortion care. In over 4,000 abortions provided since 2018, the department has only identified 2 causes to deny its license. Let's see. Any other things of note before I leave you guys to ponder and pray? Let's see. So Yamalis Rodriguez, who was the president and CEO of the Reproductive Health Services of Planned Parenthood of the St. Louis region, said that Friday's ruling was a vindication for Planned Parenthood and its patients. But the reality is abortion has essentially become a right in name only in Missouri, and unfortunately in many states to follow. Missouri's medically necessary requirements: 2 in-person trips to the health center at least 72 hours apart, a ban on using telehealth for an abortion, and a needless invasive pelvic exam, that's the transvaginal ultrasound. For medication, abortion is still making it extraordinarily difficult for people to access care in Missouri. So, just remember, I'll leave you with this, that the women that save you and or your loved ones' lives may have just had a fetus taken out of their uterus. Who cares? Who cares? So if you loved this video, give it a thumbs up. Please comment down below. I would love to hear some opposing viewpoints. Let's have a dialogue about it. I know this is obviously, for whatever reason, controversial. But if you do have an opposing viewpoint and want to share it, I welcome that. I'd love to have a dialogue and hope to better understand where you're coming from, and maybe you can hope to understand where I and like-minded people are coming from. But yeah, I do invite you to subscribe. It really does mean the world. I am going to continue this series in the politics of periods, on women's issues. I do have a video upcoming about how you can help support women in the prison system gain access to menstrual hygiene products. under the CARES Act. This is really good news, and this is in the video that went up yesterday. I'll link it as well, about how you can now purchase menstrual hygiene products with your HSA and FSA spending accounts, which after a long fought and failed battle to make that happen, it took the CARES Act to make it happen. So we'll take what we can get. But in that video, I talk a little bit about how one of the other big wins is that women, incarcerated women, no longer have to spend their own commissary money on the necessary pads and tampons. They are now free. But the upcoming video is going to talk about how you can go above and beyond that and help support these women continue to ensure that these women continue to get free access to the very necessary hygiene products for their time of the month. So if you like this series, if you're interested in women's issues, if you want to hear my personal abortion story, everything will be linked. I'll put the playlist down there. And tomorrow we will have a film review up for you. After that, I'll have some Disney content, so we'll be making the rounds. But I really appreciate you guys watching. Again, subscribe, thumbs up, comment, notification bell, like and subscribe, you get it. But thank you for watching, whether you agree or disagree. Thank you for watching, and thank you for hopefully thinking on it. Anyways, I love you guys, and I will see you on the other side. Bye.